Hi, everyone. My name is Jessie. I am an art therapist intern in ITA. Um, Before I introduce presenters, I want to read some guidelines. Um, the Again, welcome to the CBT-Oriented Integrative approach of creative arts therapy, reflection on a practical research project treating college students with depression. I would like to read some announcement and guidelines. A copy of these can be found on the conference page. Please note that live captioning can be turned on or off for this presentation. In order to cultivate a community of respect, compassion, and empathy, I ask that you use respectful language and engage using I statements while speaking or using the chat. Take care of yourself by taking breaks, managing Zoom fatigue, and reaching out for support if you need. We do not tolerate hateful or aggressive words or actions. And if harm does occur, we will invite the transformative practice to address the harm. While practicing in this session, please ensure that your Zoom name matches the name with which you have registered and include your pronouns in your name. We ask that you refrain from Zoom hopping and from sharing Zoom links with others. I'm available to help if you're having difficulties with technology and with finding the correct session. Please be aware that this session will be recorded. If you do not want your video or audio to appear in a recording, you may leave these functions off. Once recordings are available, please do not share these links with others. In order to receive CEUs for this presentation, you must complete the CEU quiz. A link to the quiz can be found on the conference virtual access page. Now, I would like to introduce Linda Cao-Baker, Hongju Li, Tang, and Qimao. Thank you.
Okay, since the difference time between Beijing and Chicago, and also our team member in the second language, now they're struggling how to get on because not familiar with the conference of procedure, and they're not used to the Zoom because they use a different format. So now, luckily, we recording our panel presentation. So I'm gonna play the video. And since this is a research project, a lot of materials, so be patient with us. We're very grateful, and ITA gave us these opportunities. So at the end, you can type in the question, and at the end we have chance to ask questions. Okay. Sorry, it's not the one I want to present. Hello, I'm Linda Cao-Baker, board-certified dance movement therapist, licensed clinical professional counselor. I will start our panel presentation. The topic is CBT-oriented creative arts therapy, reflection on the practical research project treating college students with depression. Outline of the presentation. Introduction of the project, rationale, framework, and phase one practice by Linda. Research method and data analysis of outcomes on phase one practice by Hongju. Experiential practice of body integration intervention by Tang. Phase two practice by Linda. Research method and data analysis of outcomes on phase two practice by Hongju. Reflection on music intervention with online and in-person practice by Qimao. Phase three practice, professional training by Linda. Future development of the project by Hongju. Music intervention experiential practice by Qimao. Question and answer. Introduction. This panel presentation will introduce a practical research project of use CBT-oriented integrative creative arts therapy, training college students with depression. It includes rationales and design methods of application, methods of research, outcome data analysis, and guided experiential practice. Rationale and framework of the project. Rationale 1, depression among Chinese college students. Based on official data, Chinese universities have become major areas of depression. The incidence of depression among college students ranges from 13.25% to 79.90%, while the general population only has a rate of 5% to 6%. Sleeping problem, depressive symptoms, self-harm, anxiety symptoms, suicidal ideation, somatic problem, and attempted suicide all keep increasing. The World Health Organization has pointed out that a quarter of Chinese university students have also admitted to having depression. 39.9% of surveyed university students have suspected that they have depression, and 34.38% of respondents said that even if they suffered from depression, they would not choose to seek help from psychotherapy. Rationale 2, CBT-oriented approach. The traditional psychoanalytic individual counseling therapy is popular in China, which focuses on the past, is prone to long-term with dependency problems. This project adopts cognitive behavior therapy approach based on our latest neuroscience as its orientation, focus on the present and the handling over the key of health to the clients themselves. This approach focuses on the positive transformation of thinking patterns, behavioral habits, emotional expression, and body-mind functions, then constantly and consciously redesign oneself toward health development. Rationale 3, the creative brain sets based on neuroscience. Based on discovery of brain neuroplasticity, this theory concludes that people can consciously make the brain sets as 7 creative thinking mechanisms that leads to success in one's career and personal life. Those brain sets are connection, imagination, absorption, reasoning, transformation, evaluation, and stream. Through comparative research, the closed, absolute, isolated, and catastrophic thinking mechanism of depression, which are contrary to creative brain sets, were found. Rationale 4, emerging adulthood theory. 5 characteristics of emerging adulthood. Identity exploration, instability, self-focus, feeling in between, sense of open possibilities. Our college student is in this stage. Rationale 5, theory and practice of creative art therapy. Creative art therapy utilizes action-oriented creative expression as a therapeutic process. Creative art therapy engages multiple senses and activates many areas of a brain, making the therapy experience one that uses both body and mind and works to heal or strengthen the whole person. This is the most suitable therapeutic method for young people, college students. The project will use dance, art, drama, and music as the 4 main forms of therapeutic media. Framework 1, the theme of treatment. Framework 1, the theme of treatment. 4 basic themes: emotional expression, self-esteem and confidence, social skills, stress management. Framework 2, entry points of each therapy model. For entry point of dance therapy, body information. Entry point of art therapy, thinking method. Entry point of drama therapy, behavioral pattern. Entry point of music therapy, emotional tolerance. Framework 3, 16 therapeutic intervention modules. 4 intervention modules of dance movement therapy. Expand the expressive body language. Mirroring dance of self-affirmation. Body-mind healing movements. Group rhythm of positive energy. Framework 4, 14 therapeutic intervention module, 4 intervention module of art therapy. Insights of inner out self. 6, clean clutters and lifting burdens. 7, transforming crisis in reaction. 8, exploration of dreams and paths to realization. 4, intervention of module of drama therapy, retelling the story of I, symphony of inner contradictions, role performance of behavioral reconstruction, sculptures of family and social relationships. 4 intervention modules of music therapy. 13, songwriting for spiritual sublimation. 14, drumming with emotional interaction. 15, improvisation, music and self-expression. 16, music meditation of body-mind regulation. Implementation and operation of project phase 1. Phase 1 is online group and totally 8 weeks, 2 evenings a week, 1 treatment session per time, 90 minutes per session. Use the horizontal unfolding method. Can consciously make. We used on the 4 modules is body parts, dialogue, and integration. Mirroring dance with I statement, and botanic fundamentals and movement in polarities, and 5 rhythms movement and dance with 5 elements. So this is one example. One student, she was suffering from depression. Her body had a right hand nerve damage, and she shared her experience with listening to body and dialogue of body parts. She said, when I feel my right hand, although you feel it when you touch it, but now I feel from the heart. I find that I don't think it is a part of my body. Correspondingly, I feel a little angry on the left side because it has taken on too many functions of the right side. But I have never paid much attention to it. So it feels a little angry. Going down further is hip. There is a little pain in the right hip. I use orange to represent it because I feel it is telling me I have been in pain for a long time, but you didn't notice me. The right arm is saying, thank you for seeing me. I also want to try to express the vitality of the side. Thank you for giving me this opportunity to connect with you. The left arm says, okay, you can try. Let's see what happened. its tone is very much like a parent who cares about his child but speak in a stiff tone. This is her experience. And in art therapy, this is some artwork. We focus on entry point is the thinking method. Encourage students to focus on the thinking pattern, especially the thinking habit when it's in difficulty situation or crisis. And through the creative process of art, attempt to establish an open, flexible, connected, and transformative thinking mechanism. The techniques we use on the 4 module is a landscape of inner and outer self, and letting go from words to art making, like this one, and this is like cat. This is like she won't let it go. Use the cat to lift it up. And a reconstruction of the painting on the crisis situation. Ideal oneself through planting my tree. This is an example drawing reconstructing myself. And the topic is when you're in crisis situation, how do you feel? This student shared, she draw a can squished inside, squeezed in the middle into 2 parts. She said, I turned the remaining part over when we remake it. Say, can you remake? She said, now you mentioned look it from different angle. I was just thinking about how to change the angle of this thing. I want to look at it from the inside. This whole thing is like turning a tube from inside out. I feel things inside, and it's not just black and white. Maybe for me, the outside world gave me black and white, but in my heart, inside me is just color, still colorful. It is still the color of the blood, the color of flesh, and the color of fresh life. The 2 arrows, the initial squeeze force turned it into a force from inside out. Break this dilemma. I add 2 strokes of yellow. This light yellow is the mood I talked about at the beginning of today, the color that gives me peace of mind. So this, her reconstruction, totally changed from outside to inside. Drama therapy, entry point, behavior pattern, let student get insight, understand unhealthy behavioral habits, and experience the development of new character roles and healthy behavior patterns through dramatic performance. Techniques on the 4 modules we use retelling a story of where I come from, performing inner voice of conflict, self-evaluation through 72 role system, and my solo system, family, and relation sculpture. So this is a picture doing a relation sculpture. And this one's mom always stare at me. I'm just gentle. And then she said, I said, how you want to change? She said, I want to mama to listen more. And I said, how can you make your mom listen more? Then she put her own sculpture up. I need change myself, be more confident and speak up for myself. This is a retelling story. The story, she draw her story, then she system, family, and relation sculpture. So this is a picture doing a relation sculpture. And this one's mom always stare at me. I'm just gentle. And then she said, I said, how you want to change? She said, I want to mama to listen more. And I said, how can you make your mom listen more? Then she put her own sculpture up. I need change myself, be more confident and speak up for myself. This is a retelling story. The story, she draw her story, then she tell the story. A young girl at the autumn moon holiday was eating moon cake and enjoying the moon by herself. That as an adult, feeling sad, she look at it, said, feeling sad, lonely. When I look at this image, many lonely days in her life. Think about this girl. Then retelling story, and after listen to group people's feedback, that she can really telling story. This young girl was brave and creative, dreaming about her future. That's why she entered one of top universities in China. Music therapy, entry point, emotional tolerance, related student therapy. The nervous system that runs through muscles, bone. Sorry, this the movie is not match. That's why she entered one of top universities. She looked at it, said, feeling sad, lonely. When I look at this image, many lonely days in her life. Think about this girl. Then retelling story, and after listen to group people's feedback, that she can really telling story. This young girl was brave and creative, dreaming about her future. That's why she entered one of top universities in China. Music therapy, entry point, emotional tolerance. Let the student recognize the emotional response mechanism to stress and learn emotional regulation skills to enhance their psychological endurance, emotional tolerance, and management capability. The techniques under 4 modules we use expression through self-picked instrument, and even just like a box or the play, improvisation of creating own lyrics, body drumming and interaction, humming and music relaxation. This is a lyric. I'm going to translate this lyric. Student wrote, example, creation of self-affirmation lyric. Brave people, look back. There will be collapse, there will be sweat, there will be inspiration. Thank you for your persistence. Even if it is ugly, even if it is embarrassing, always towards light. Please remember your dream, but don't forget the scenery along the way. Leave the eyes of others, take your own. Do what you can. This is better me. Tears are no longer sad, but joy. Love what you love. Love this world with all your strength. Be yourself. Leave the trace. So what if you die? Next one is Dr. Lee.
I have worked with Linda to train Chinese and associate professor in Beijing Normal University. I have worked with Linda to train Chinese graduate students of dance movement therapy together. I'm also the director of the Arts Therapy Research Center in our university. Today, I will introduce the research method in our program. We conducted 2 intervention studies, one online and another in our university classroom. Linda has showed the concept and the design of the project. Now I will show the project implementation and operation in the first phase of our study. It can be roughly divided into 4 steps. 1, recruitment of subjects.
2. Sign and inform the consent form. 3. Group activities. It's about 16 interventions per week. No. It's about 1 interventions per week, about 8 weeks. 4. Questionnaire interventions. Interview. I will introduce how we recruited the participants. Our arts therapy research center has a WeChat official account, and we made a notice of recruitment of research subjects on this official account. Then the applicants will be screened. The informed consent form will be signed by those suitable students for the program. The next part is the effect and conclusion of the project. We did a tracking research. It will be carried out in 3 steps. The first step is to collect the data, followed up data analysis, and finally discussion and summary. In the first intervention, online intervention, 13 people joined and 9 people persisted until the end, participating in 8 activities for 2 months. The anxiety and the depressions were investigated by questionnaire before, during, and after the intervention. We examined the impact of the intervention on participants and their experiments of participation with special research questions. For example, can creative arts therapy elevate students' anxiety and depression? Semi-structured interviews were conducted before and after the intervention to collect participants' feelings and their thoughts. The interview time is about 40 minutes, and the recording manuscript and the interview's observation summary were retained. This is the statistical significance test result of the questionnaire data in pre-test, middle test, and post-test. Since the sample size was less than 50, the Shapiro-Wilk test method was used to carry out the normal test on the SDS and SAS scores of the subjects before, during, and after the treatment. And the data show that it conformed to the normal distribution. At the same time, the results of the variance homogeneity test also met the conditions of the paired sample test. As seen from the table, during the pre-intervention period, the subject means SDS scores decreased, which means the severity of depressive mode decreased significantly. There's no significant decrease between pre- and post-test of anxiety symptoms. It may be related to the unavoidable stress caused by academic and academic problem or the final exams. Because the post-test time coincides with the final exam. In our university, final exam led to increased anxiety for 2 students. According to the data, the median line chart shows a decreasing trend in anxiety and depression levels. Okay, you can see from the chart, for participants' levels of anxiety returned to normal when participants' anxiety level decreased from severe to mild. In the early treatment phase, the severity of the participants' anxiety significantly decreased. The depression score of the experimental group was significantly decreased compared with that of the control group. Participants were administered semi-structured interviews in the study. The pre-interview focused on the recent emotion, feelings, and experience about participating in program, and the post-interview included the recent emotion, feeling, and experience of dance movement therapy, art therapy, drama therapy, and music therapy sessions. And as well as we will gain some information for 4 perspectives, including mind-body integration, thinking model, behavior, and emotional management. There's participants experiment with the 4 types of arts therapy. You can see the participants generally had a good feeling about visual art therapy, mainly because the difficulty of participation was low. In music therapy, 4 participants mentioned feeling a strong sense of group cohesion during the sessions. At the same time, music therapy also brought intense aesthetic pleasure. Participants' evaluations dance therapy vary significantly. Sorry. And the intervention has made some members feel physically relaxed and emotionally relieved, bring about a sense of unity between body and mind. And at the same time, due to the online intervention, some participants find it is difficult to find a private and safe space, or they may feel awkward and unable to engage because of lack of exercise habits in daily life. Participants' evaluations of drama therapy mainly are neutral aspects. The results highlight that different participants have varying preference for different media in creative arts therapy due to personal experience, orientations, and other factors. We analyzed the number of participants who thought that they had improved in the areas of mind-body integration, thinking models, emotion management, and behavior during the interviews, as well as the related expression. Although dance therapy presented challenges for the participants, 8 participants reported significant improvements in their integration of mind and body. Six participants reported significant improvements in their emotion management, including the intervention's ability to relieve negative emotions. They were able to be more sensitive to their emotions and master new ways of regulating them. 3 participants reported significant improvements in their behavior, including changes in previously strict routines and increase the physical activity in daily life. The remaining students felt that the improvements were minor. There's some case study. Yes, the A student, her right hand was injured and still had functional limitations after recovery. Through the body scan session, she was aware of negative pain, and after the intervention, she thinks it helps her much more. The B student experienced the sudden loss of love. She felt powerlessness, anger, and depression. Through group therapy, she gradually accepted this loss and became more emotional rather than being as a cold-blooded and drifting towards extremes due to overly rational thinking in the past. The research findings indicate that cognitive behavioral oriented creative arts therapy can alleviate anxiety and depression in college students. Our study is very useful to those students.
Okay, now we're going to present experiential exercise for body integration
from Beijing Normal University. Today, I will lead you to warm up with the image of the tree growth. We will first imagine ourselves as tree roots dancing with the earth, and then imagine the trunks and the branches growing out of the soil, dancing in the sky. If you can lie down, please feel the ground with your body. And if you can only stand, feel the contact with the ground with your feet. Breathe slowly. For the 5 minutes, we will become a breathing forest. Please focus on the lower part of your body and imagine that there are growing fine roots extending downwards through the ground, expanding outward. Feel the flow slowly grow inside your body. When your roots touch the moist soil, let the body gently engaging and stretching as absorbing water. Try to draw small circles with your knees as the roots are exploring in the soft soil. Feel the power of being supported by the earth, the gravity of the earth center, which firmly anchors our pelvis. You feel the warm current flowing between your waist and abdomen. It is the nutrients collected by the roots. They are being transported upward. Let the spine spiral up slowly like a tree rings, and the fingertips will move the leaves when they pass in the air. Stretch your arms to both sides and imagine the temperature changes when the sun passes through your finger. Feel the breeze in the forest, and your head will drive your cervical spine. Swing gently. Each tree has grown into its own appearance and has its own strength. When you stretch in different directions, your feet are still deeply rooted in the earth. Take a deep breath, and when you inhale, the crown of the tree grows towards the sky. And when you exhale, the roots go down into the soil. Take another deep breath, and when you inhale, the crown of the tree grows towards the sky. And when you exhale, the roots go down into the soil. Slowly open your eyes and see that the whole forest is breathing in the same movement with you. Slowly use your body to find the tree you like. Stand quietly and feel the wind and the earth. Slowly use your body to find the tree you like. Standing quietly and feel the wind and the earth. Thank you and your companion for building a healthy world with us. Thank you and your companion for building a healthy world together.
Implementation and operation of the project, Phase 2. The Phase 2 practice, based on the fact that the participants are prone or peripheral or resistant to certain art forms. Phase 2 practice, we change the original separate art forms to cross-use, which allows the participants to gradually adapt to unfamiliar or uncomfortable art forms, helping them to step out the comfort zone and improve the openness of thinking and behavior, and enhance the therapeutic effect. In addition, the unfinished part of an intervention module can also be continued in the next activity. The organic combination of various links can be more conducive to in-depth exploration of internal experience. We did in-person group 4 weeks, twice a week. 2 treatment sessions per time, every time, 60 minutes per session. The spiral upward approach of one interventions in dance, art, drama, and music. One after another. Week 1. Module 1 also is a session 1. Dance movement therapy. Tension release through rhythmic movement. Module 2, art therapy, clearing clutters, lifting burdens. Module 3, music therapy, music listening for emotional expression and regulation. Module 4, drama therapy, retelling the story of I. Week 2, Module 5, dance movement therapy, mirroring interaction for self-affirmation. Module 6, drama therapy, symphony of inner conflict. to action for self-affirmation. Module 6, drama therapy, symphony of inner conflict. Module 7, art therapy, comparison of inner and outer self. Module 8, music therapy, expression through song with movement. Week 3. Module 9, music therapy, music meditation and relaxation exercise. Module 10, dance movement therapy, body-mind integration and healing movement. Module 11, drama therapy, family interpersonal relationship sculpture. Module 12, art therapy, collage of exploring dreams and paths. Week 4. Module 13, art therapy, symbolic drawing of defense mechanism. Module 14, drama therapy, improvisation of role playing of characteristic behaviors. Module 15, music therapy, drumming circle, interaction to supplement the spirit. Module 16, dance movement therapy, energy transformation and collective resonance. Intertwine with dance and art. The first session is dance. Therapy and release stress from the body and mind. The second session is art therapy. Write down the current distress and burdens that you hope to get rid of. Then create a new image to achieve the purpose of clearing clutter and lifting the burdens. This is intertwined with art and drama. Draw my psychological defense mechanism, improvisation of role play in groups. This girl performed a boy's mom, who has the same kind of defense mechanism, separate self, avoiding from others. And after the performance was very powerful, she suddenly felt like she understands her mom, who was so protective and very tough on her, that's where her mechanism come from. She was able to let go of anger, and she realized how can she break through this mechanism. Intertwine with music and drama. The first session is music therapy meditation, listening, promoting emotional expression and regulation. Listen to songs with the theme of I, recite the lyric, and use musical instrument to play out your feelings. The second session of drama therapy, use poetry and prose sentence to tell the story of I and retell the story of I reciting your writing. So the theme continues. Intertwine with music and dance. The first session of music therapy involves meditation combined with music. Imagine my safe island and sharing paintings. The second session of dance therapy involves body scan, practice progressive relaxation, and basic movement of botanic fundamentals to achieve physical and mental integration and healing. And the participants fully immerse themselves in creative activities such as painting, cutting, and pasting, explore, and expanding oneself through artistic creation. Unlike obstacles of virtual groups, dramatic interaction in person is full of power of energy transformation. This is most dramatic activity. Reflection as a therapist. Reflect on phase 1 practice. The online form can break geographic restriction and provide geographic convenience for participants. In terms of communication, it can avoiding the embarrassment and discomfort caused by unfamiliarity in the early stage of treatment. However, the screen brought certain level of barriers to observation, interaction, and connection. Most participants responded positively to art therapy interventions online, where a few showed negative ineffective responses to dance or drama interventions. Due to the limitation of video screen, it poses certain difficulties for therapists to capture participants' emotions at any time, and also brought the inconvenience to intervention forms with strong movement such as dance and drama. A question of how to help participants working out the comfort zone is raised. The separated use of art form is not convenient for transitional transformation of participants who are resistant to a certain art form. No male student participate first online group. Question: only girls accept creative art therapy? Reflect on phase 2. The therapist can timely observe participants' body, language, and facial expression, and intervene in time, and the treatment effect is significantly better than online session. Fully utilizing the strong motor skills of dance and drama, it has achieved a very positive on-site therapeutic effect. The comprehensive spiral cross use of dance, drama, art, and music helps participants to gradually try unfamiliar or uncomfortable forms, which helps them to break through old thinking and behavioral habits. The participation of male students, mostly from science and engineering programs, and the obvious positive effect of their transformation proves that creative art therapy is also suitable for male students. The feedback from one male student. He said, I have achieved a qualitative leap in mindfulness practice. I have previously learned mindfulness techniques which are difficult to engage with my daily life. For several weeks during process, creative art therapy constantly experience from various sensory system stimulation. I was certainly able to use mindfulness techniques naturally, perceive my body information anytime and anywhere. I listen, watch, feel the detail surrounding me, and gain insight into my thinking and behavior. I have been able to relax a lot more.
I will introduce the research on second term of practice. The first questionnaire measurement. There were 27 students who signed up, exclusion of those with severe depression, and make sure they have time to participate in intervention activities. 60 students were selected to participate in the project. The table shows the measurement results of SDS and SAS before and after the intervention, and the comparison before and after the intervention shows the changes in depression and anxiety emotions of the subjects during the treatment period. According to the table, after one cycle of art therapy intervention, the mean SDS score of the subjects decreased, so the severity of depressive emotions has significantly decreased. At the same time, the post-evaluation of results of SDS showed that 6 out of 15 participants had recovered to normal levels of depression. The mean SAS score of the subjects before and after intervention also decreased. The severity of anxiety among the participants also significantly decreased. The arts therapy in this period had a significant positive impact on the subject's anxiety and depression. The project summary. First phase of online arts therapy intervention. 1. The online form can break geographical restrictions and provide geographical convenience for participants. Second, most participants responded positively to arts therapy, while a few showed negative or ineffective response to dance drama intervention due to the limitations of online video. 3. It raises the question of how to help participants to get out of the uncomfortable area. The second phase of offline arts therapy intervention. 1. The therapist can timely observe the participant's body language and expression dynamics and timely intervene, which is significantly more effective than online treatment. Second, the strong action of dance drama was fully utilized, which resulted in a very positive on-site therapeutical effect. Third, the comprehensive spiritual use of dance, drama, art, and music helps participants to try unfamiliar, uncomfortable forms in a graduate way and helps them break through their old thinking and behavior habits. Fourth, the participation of boys and the obvious positive effect of their transformation prove that arts therapy is also suitable for boys. Most participants said that through this activity, they had achieved a different degree of positive improvement in their physical and mental attention, thinking methods, behavioral patterns, and emotional management, which paved the way for their healthy growth in the future.
Dear experts and scholars, my name is Mao Qi. I'm a postdoc at Peking University and a music therapist. Today, I want to share our CBT-Oriented creative arts therapy practice for college students. Okay, this is my PPT. Okay. In this part, we focusing on improvisational music therapy interventions across online and live setting. Okay, let me take you back to these pandemic days. You know, how everyone was stuck at home. We asked students, hey, grab anything around you, a vase, water cup, even an empty Coke bottle. Turn it into your instrument. Then use this real-time music mirroring tone, basically like a musical Zoom call. They'd play songs to mirror each other's feelings. It wasn't perfect, but you could feel the message, I hear you. We're in this together. What happened there was two things. First, getting those feelings what without words. Instead of saying, I'm sad, you'd go. Second, building empathy through music code breaking, like, oh, when she spit up her coffee cup, that's her I'm anxious voice. And my favorite feedback, one student said, when I heard someone answer my sad music with theirs, it was like I wasn't alone in that dark room anymore. Next, let's see. Our vocal improvisation is called toning practice, including step 1, 7 meeting tone. Everything is okay. Step 2, 10 meeting silent reflection. Step 3, translating the experience into abstract plantings. In online sessions, students used smartphone microphones. One student's planting shifted from chaotic red stalks to soft blue, reflecting CBT's body, mind, awareness principle. Okay, let's see this. We also encourage students to write songs. Taking into account their musical level, we mindfully use the improvisation of lyrics without the song. Finally, our live ISO principle method highlights music to emotional states. This is an important technique in music therapy. We help the students to vent inner difficult to express emotions, enhance him or her state of mind awareness, free up space for him or her positive emotions to emerge. In the face of a person with anxious emotion, we use sound, my voice, and piano music to empathize with his emotions. Follow him and develop our music. Then use our music to turn his original emotions into climb. This is the live video. This is my voice.
This is not a student therapy session. This is a training. This is a training class for intervention for our mind.
一切的梦想当下成真。我又是什么状态？我都没了，有什么意义？
也是出来对的。你中有我，我中有你。
回到了永恒的家，回到我们彼此拥有的家，回到永恒。
Okay, thank you for your listening and look forward to our next practice on tuning.
Okay, now I'm going to talk about phase 3, professional training for project promotion. We did 3 days intensive training, practice of 16 modules. First of all, we created a written training manual that includes introduction of the framework of the project, theoretic foundation of CBT-Oriented creative art therapy for treating depression. That includes why depression has become an epidemic, a brief introduction to cognitive behavior therapy, mirror neurons and embodied cognition. Creating art opens the door to the soul. Then 16 modules of the intervention practice that includes rationale for each module, procedures of how to apply the module, materials needed for interventions. Those are the pictures of training. We have about 50 participants. They are teachers, counselors, art healing practitioners, art therapy lovers, and the whole process was very touching, powerful. People are highly energetic. After that, we made production of 16 short films. We had everyone sign the consent during the training. So we filmed the whole process. Then we made the 16 short films. So everyone can have the model of the video for the reference and instruction to do training and practice. Next, Hongju.
Now I will introduce the project promotion. College students are our country's hope. Their healthy growth will make our world a better place. So we have started promoting the practical model of this project. We will continue to promote the concept of this project and cultivate Chinese arts therapists. First, we will do some work in promotion of arts therapy courses in Chinese universities. Now we have published a textbook. Second, we will training for Chinese social arts therapy and therapists. There's some short-term training course. Third, we will do the promotion of mental health teachers and other teachers training in Chinese schools. We have designed a long-term series of online and offline training, organized a team of training teachers, and will officially start in April. With the increasing emphasis on mental health in Chinese society, arts therapy has gradually gained attention and developed in universities and research institutions in China. Beijing Normal University and other universities have demonstrated significant advantages in theoretical research, talent cultivation, and practical application of arts therapy, promoting the integration of arts therapy theory and practice. Our team is about to launch a series of training programs for arts expression and psychological health, using Linda's monograph and other teachers' books as the training material. After 2 years, we hope to cultivate a group of arts therapists and arts facilitators in China with solid theoretical knowledge and practical abilities. Thank you.
Our last one.
Welcome back. Let's do a short turning practice. First, please find a comfortable place to sit down. Then, close your eyes. Very good. Now, please take 3 deep breaths. Okay? The first deep breath. The second deep breath. And the third deep breath. Next, I will play a piece of music accompanied by human voice. Okay, a woman voice. So please hum. Any sound is comfortable. With the music, find the sound that feels most natural and comfortable to you and keep singing. Okay. Keep your eyes and find the sound that feels most natural and comfortable to you. When the music is over, please hold the sound you just made. Let it go through your head. Then your face. And your neck. And your shoulders. Then to your hands. Your chest. The stomach. Your back. And now, let the sound reach your feet. To your whole body. Okay, please sit down. Close your eyes. And now, don't make any voice. And take one last deep breath. And then, when you are ready, please open your eyes. How does your body feel? You can tell yourself and be grateful for the practice you just tried. Thank you for your complaint, and I look forward to seeing you.
See you.
Okay, if you like to turn on your video, everybody. And so I apologize for the inconvenience of the video play, the match, the sounds, and the words not match well. So we will send the materials of a PowerPoint to the conference so you can review if you have any questions for written materials. And now we are open to the questions and any feedbacks. And this is a long-term for we practice like start from 2022, and the project is ongoing now in the ending phase, the promoting and the training. And the video Mao-Chi played is a training video. We already did short-term training, and we did online practice and in-person practice. And so Hongju is doing the whole research, has a whole team, her student, graduate student, do all the materials, did a lot work. And this project is sponsored by the foundation of University Foundation, and especially for University Research Project.
Hi, I have a question. My video isn't working right now, but
yeah. Oh yeah, Catherine.
I'm curious because you said it's in the, like, you were training professionals. Has any of them implemented it yet and tried it out and given feedback?
That's a very good question. We haven't research on that, but I know a lot of people tell me they do they didn't do 16 module because there are certain areas that not have enough training yet, and they did a lot of dance, healing activities from the module, like mirroring exercise, botanic, healthy movement, body integration, and rhythmic, like 5 rhythm, and the 5 elements dance I create in that module, they all practiced. And also a lot of art related to, but they haven't had enough training to utilize those form of intervention yet. So we're doing the long-term training and do the module more practice, more detailed training. And it's ongoing. The art healing practice is very, very popular in China now because everybody wants a piece of like a Renaissance. Every school, every community, everybody wanted. So they are really into the training. They want to practice, but they're not really certified dance therapists or art therapists. So we designed the module like them leading the healing activity for the disease prevention or recovery.
Thank you. Now I have a follow-up question because of that.
Yeah.
Have you thought about, or has anybody asked if they could have other creative arts therapists where their team isn't as comfortable leading just come in to work with them? Or
you said invite the art therapist?
Yeah, so if they are comfortable in dance movement and art therapy, but not in drama therapy and music therapy, have they invited, or like, are they calling for?
Yeah, we do invite Hongju you understand the question? We do Hongju invite music therapy, art therapy from like a central art school institute in Beijing, and some drum therapists, because training the drum therapists is really few, and we have some in our school, and we invite them. And there are some conference we invite them to. And in our school, we have a drum department, not drum department, we have drum program. We do some acting. So that in China, they do the immersive drama healing activity for teenage depression as a research project, especially use drama acting. And but they're not certified drama therapists, but they use drama to monitor the emotions and the behaviors. And China is getting there. Very, very exciting process. Thank you for asking this. This you are really point the really critical issues, because they need experts. So a lot of universities, those top universities like Beijing universities and the Central Art Academy in Beijing and the Central Music Academy in Beijing, the all top art school all start organize the training, invite a lot of Americans and therapists to do the training for teachers. And our project is a part of those process.
Thank you.
Thank you for your question.
Exciting.
So that's Jessie. We may need you a lot since you're Chinese, you speak Chinese language. Hongju Jessie is an intern art therapist in ITA. So you must connect with her. We need you badly. Yeah, she's art therapist. Yeah, she's from China.
Thank you. Yeah, I would love to. Yeah. We have any more questions? Any more questions? We'd like to welcome questions here.
Sorry, I have one more question.
Yeah, go ahead, Catherine.
Right now.
Yes, go ahead. I love questions.
I'm just curious about, I know, of course, you're still in the research phase and kind of ending that. Do you have intentions of bringing the program to other countries?
Do you have intention? 你想把这个带到别的国家吗？这个项目。
Yeah, it's okay.
Yeah, we haven't thought about that. This is the first step we present in this conference. We want to get this idea here, see everybody's response and input. And I think in different country probably has a different issues, and we are limited, with Chinese background. But yeah, I was from Beijing, and I practiced over 30 years in US. Then I'll go back to Beijing University for create the program. And this project, because China, just the depression in schools is terrible now. And middle school and elementary school, we only think about go to middle school and elementary school, because the depression is really getting worse there. And we haven't thought about to the different country. Maybe that's a thought we can discuss about that. Thanks for bringing that.
Yeah, absolutely. I was just thinking about, as much as I hate system, like diagnostic systems and insurance, insurance really loves CBT, and I'm just thinking about how useful this would be in schools here in the US. I mean, we still see depression and we see anxiety, and
absolutely,
insurance loves the use of CBT, and for us to be able to use the arts but still have the ability to code.
Yeah.
Use of CBT, I think that would be really useful here as well. So yeah,
thank you for brought that, Catherine. That's a great point. And in China, we saw the issues in school because you need a prevention, because Chinese people resistant to the word of therapy, psychotherapy, or mental health. So with creative art therapy, everybody open to it. If you bring to school, I think it will be really useful. And in China, have a unique thing. They have a called aesthetic education. So from elementary school, middle school, high school, and university, everybody has to take this art education, aesthetic education for your mentality, for your grace of soul, and it's kind of like mental health. So that's a very good area for us to bring this education, the health concept, therapeutic art into this course. That's why I wrote that book. They gave me a chance to teach in that course for 3 years and bring the concept into this aesthetic education course. And so that opened the door. So not just for therapy and for everybody's healing. And the CBT, I think CBT more useful for China is because China is more still in the stage of psychoanalysis, but they haven't opened to the neuroscience that much yet. But Beijing Normal University is very advanced because we have top psychology school in the country. They have very advanced neuroscience research institute in that school. So, so we match, we work with them a lot too. So, Catherine, if you can collaborate with Beijing and maybe bring some to US, well, we'd love to have that project. Hongju, you understand?
Yeah.
Yes,
Welcome
that
to
would be
Beijing,
great. So,
Kathleen.
Catherine, do you work in the school?
Actually, I do not work in schools. I actually work with senior communities.
Oh, senior community is
senior
a big
community.
thing in China too.
But
Yeah.
I do see a lot of, I mean, I do have a lot of colleagues who do work in schools and, you know, talk about that. And also I used to work with children. So I know the importance of art and the usefulness of all the creative arts and accessing expression and working through whatever they're working through. So
yes, that's great. Thank you.
Thank you. Thank you.
Thank you. Thank you so much.
It's a lot of brainstorming. Yeah, we'd like to collaborate one project. You know, in China, senior healing is big in China because they really respect the elderly, and that's a big project too. But now because we're in school, the leaders of university want us to focus on the kids more.
I saw something on the chat. I just want to share with everyone.
Okay, I want to make sure I know. Everything good.
Livy said there is an incredible value to be found in how cultural connectivity can occur in the exchange of bringing Chinese art therapy research to other countries or to even different communities, not academic, within the area. And they also said, please feel free to reach out. They would love to connect with you all with their academic crew at Orion. They run 8 weeks group in school. Thank you. Thank you.
Thank you so much. I will put our material together and put our connect information there. Dr. Jules Mai Mao-Chi. Mao-Chi is a postdoctor in Beijing University now. They are really into, they have a lot of professors into this art therapy research now. So that would be great. Then if we, in the future we have some project to work together, that'll be really exciting. So it's time up.
Well, thank you, everyone. That was wonderful. Thank you so much. Just want to post a quick reminder for receive the CEUs for the presentation. Please complete the CEU quiz. You can find the link at the conference virtual access page. Thank you, guys. Have a
Thank
great night.
you.